Hi, my name is Carolyn McBride and I'm a registered nurse at Bella Glow Med Spa in Carlsbad. And this is my patient Sheena, and today we're gonna play with some dermal fillers. We're gonna do a little bit in her lips just to help rehydrate her lips, just add a little bit of volume because as you can see, she doesn't really need that much volume. And then we're also sculpt her Cupid's bow because she really loves that defined V Cupid's bow. And then for the mid face, as you can tell, she doesn't need anything in the mid face. So we're gonna just place a tiny bit up here in the upper zygoma area just to try to help lift and kind of pick up just a tiny bit. You want to be really picky and choosy with who you decide to do fillers on, and you need to understand that adding volume into the face, you don't want it to add too much volume. So she's a perfect candidate and an example showing that you would definitely want to stay away from here. So anybody really is going to be a candidate for fillers, but here at Bella Glow, typically we like to treat women that have some volume deficit. Depressions in the mid face. I like to, as a nurse, just look at a face, find the little divots and depressions and just add back that volume that has been lost over time. I don't like to put too much filler in because that can look a little bit scary sometimes. I really like to use dermal fillers with combination therapy, such as like skin resurfacing, peels. Sculptra also goes really well with it as well, but today we're just gonna talk about the hyaluronic acid-based fillers to lift, contour the face. So for her lips, as you can see, they're already very full and hydrated. So we're just gonna do a little touch up for her today, and we decided to go with Restylane Kiss, which is actually FDA approved for the lips. It's not a very thick product. It's more on the thin side, and we love it here. It leaves a really pretty pink undertone, and the girls tend to love that also. And then for the mid face, there's two that I will typically choose from. I'll either go with Restylane Lift or Contour. For the mid face, you're gonna wanna pick something that's a little bit thicker with a little bit more of a G prime to kind of lift and pull up. So those are gonna be Lift or Contour. I really like Lift up here in this upper zygoma just to kind of like contour, sculpt that cheekbone. And then in here, I really like to put Contour in there because that's also gonna help with like expression, and it's gonna blend really well when the face is animating and moving. Here at Bella Glow Med Spa, we offer two different kinds of numbing. We have topical numbing, which has the benzocaine, tetracaine, and the lidocaine in it. And you can sit with that on your lips for a while. I get pretty numb with that, but if you're extra sensitive and you need a little bit of extra something, we do offer 1 to 2% lidocaine injections as well. We clean the mouth and we just go right on in up in the gums in the specific area, and that will just kind of numb them out. Most of the time though, people here at Bella Glow, they're very comfortable with just topical numbing. I feel like we try our best to make everybody comfortable. This is the Restylane Kiss that we're gonna use for her lips today. I like to pre-fill this into these little baby BD syringes because I find that I have more precision with these. I can tend to lift a little bit better, sculpt, shape a little bit better. And yes, these are my favorite to use. These are just little Botox needles. So when I'm injecting her and when I'm using this technique, I like to do little vertical tents, and I like to start right below the vermilion border. Typically, if you start on the vermilion border, you're more prone to a little bit more migration. As you can tell, she already has a very defined border, so there's no need to even go near the border. So going right below the vermilion border is very important for her. And then also just by doing some little vertical pulls, it's going to help lift the lip and add a little bit of volume. But typically if I want to add a little bit more volume, I'll do some horizontal threads. So now I'm just gonna do a couple little horizontal threads just right in this little wet area right here, just to add a little tiny bit of volume, not much, because like I said, she already has a lot of volume, but it will also rehydrate and just kind of help minimize some of the little fine lines in there. So I like to just kind of go right in there like that. And I'm very superficial as far as the plane, You don't want to be deep, you don't want to be near any vessels. One more, and I just want to try to define her bow a tiny bit more. I'll just do a little, look how pretty that is. I'm going to do a tiny bit on this side. And once again, I was very superficial when I'm injecting. That's typically the plane you want to be in. You don't want to be deep near any vessels. And if you want to check too, sometimes with patients, you should get in the habit of lifting their lip up, seeing if you can see anything pulsate at you, so you can rule out any of the vessels when you're injecting. And that's perfect for her upper. I'm gonna do a little bit on the bottom now for her. So also when injecting, if you want to aspirate the needle, you can do that as well for safety. Typically you just insert it like that, and then I'll just give it a little pull back like that. Make sure you don't get any blood return. And then I'll do a little thread. I've been injecting for a really long time, so I know that I am not deep. I know that I'm superficial. I've already assessed her. I've looked at all her vessels in her mouth. We know kind of where they're all at. So I'm comfortable just doing little tiny horizontal threads, superficial, without pulling back. But I always pull back and aspirate if that makes you more comfortable as an injector.
So we're still doing the scaffolding?
Just little threads. Now I'm gonna do a little lifting right here. So we'll just all done with that. We always like to educate our patients on safety measures. So usually after done injecting, I'll take a little Q-tip like this, and I help them understand what a good capillary refill looks like. So you just want to make sure you see the pink come back fast, right, when you press on it, and you want to make sure that there's no delayed capillary refill. If they go home and they notice a delayed capillary refill, we always say come back and let us check on them. We've never had any issues before with anything like an occlusion, but it's always good to be safe and to help educate them on what they need to know to look out for different events of that sort. If you look up here, she's just a tiny bit flat right here, and she could use maybe 2 or 3 little boluses right on the bone, just right here, to kind of help contour that a tiny bit more and possibly even lift up a tiny bit to take away some of this fullness. I go right in and I'm right on the bone. So when injecting, I usually push about 0.2, sometimes 0.1, 0.2, just depends on your assessment of the patient. I would not push more than 0.2 at a time unless if you're gonna re-aspirate again. For me, I'll usually do little 0.2 aliquots, and then I'll take a look at their symmetry, I'll assess the situation, and then I'll determine if I need to do any more injections or not. Remember, we're always gonna be flatter on one side. It's very, very typical for a patient to be flatter on the left side because they're driving on that side, so they're getting hit by the sun on that side, and then also they sleep on that side. So you might end up doing like 2 syringes on one side versus a half a cc on the other side. And you just have to show them the pictures and explain to them, hey, look how asymmetrical you are. This is how we're gonna correct it. And get on a good game plan with them. Oh my God, do you love them? They're so beautiful. Yes, just a little touch up. So the results are instant, obviously, with dermal fillers, but as you can tell, they swell, right? So I typically tell people from swelling, it goes down about 40%. And the girls love the swelling, so unfortunately they're probably gonna need more syringes after everything kind of settles in. It takes about 3 to 4 weeks for the filler to fully integrate with the tissue, like bruising and all that. So typically if you inject somebody and if they wanna add more, make them wait like a month and then they can come back for a follow-up and a touch-up. All of our patients leave with a little brochure with all the aftercare listed. We also email it to them prior and after again. It's very important that they sleep a little bit elevated to help promote a decrease in swelling on the areas that were injected. Also avoiding exercise for 24 to 48 hours, and then also no heat for about 10 to 14 days. So yoga, sauna, jacuzzi, anything super hot that's gonna help metabolize it, you kind of wanna stay away from. Yeah, so as far as aftercare, it's also very important to explain to them, obviously, like complications, like I told you before, checking the capillary refill, and just making sure that safety is number one. As far as pricing goes, every med spa is gonna have different pricing, but here at Bella Glow, we love our Derma family of fillers. We use these the most. Typically for lip augmentations, we usually do like a first-time patient promo, probably about $550 for the syringe. That's with like a $50 savings. And then that will kind of get patients in the door for an assessment and then to do other things. And when it comes to the mid-face, remember, it's not a one and done kind of thing. So typically I love to start with like 3 syringes. I feel like that's great. And Restylane Lift or Contour run about $850 a syringe. But sometimes with how awesome our reps are, they'll help us do like a buy 2 get 1 free promo, which really brings the cost of the syringe down significantly. And like I said, yeah, fillers are not a one and done thing. So it's really important that you get on a game plan and a budget with your patient. And a lot of the times patients aren't gonna have like $5,000 to drop on like a bunch of syringes. So I usually will be like, okay, today we're gonna do 3, and then you're gonna come back in like 2 or 3 months and we can assess the situation. We can do a little bit more and see how you feel. It depends on what kind of correction they need. My favorite corrections are women that are more mature. Obviously, they have a lot of lost volume in the face. Saggy jowls. I really love to take dermal fillers and reshape the mid-face, lift, augment the jawline, fill in this pre-auricular area right here. And yeah, those videos will be to be continued for our next shoot.